So the Surgeon General just declared a mental health crisis in our kids and adolescents. And this has been a crisis that has been budding since before the pandemic, but really has reached a fever pitch over the past several years.
When you have a child who is going through some challenges, who may need a little extra support in a program like this, it's really difficult. It's really hard to find that. So arming our staff with the skills to do that is huge and so important.
We've started with a really fabulous evidence-based practice called Youth Mental Health First Aid, which is a gold standard evidence-based training curriculum that helps adults understand how to identify, approach, refer and support kids who might be struggling with a behavioral health challenge. And it really empowers the adults in those kids' lives to be able to support effectively.
That got us to really think deeper about what some of these kids and staff could be struggling with on a daily basis, and how to respond to some of the crises that might be coming to our camps that we might not have been aware of just by reading their paper documentation.
During the summertime, school's out. And so who's supporting our kids? Well, that is YMCA staff. That's our counselors. That's our camp directors, our program leads. And you guys are the ones who are caring for our kids during the day while us adults are busy at work and helping them run and play and have fun, but also you're the ones who are helping them learn really critical social skills, emotional skills, self-regulation skills, and we'll be the ones who are there if they have trouble during the day.
Camp is supposed to be their fun, exciting time of the year, but oftentimes this camp season could translate into more issues that would actually be more prevalent here in camp than it is in after school because we only see them for 2 or 3 hours a day.
Our summers are 10 weeks, long days, 8, 9, 10, 11-hour days for some of these kiddos, and our staff need that support when it's happening.
By partnering with the YMCA, we are also able to build capacity in our community so that we're able to address the mental health crisis head on and ultimately decrease the amount of need there is in the community.
During the school year, we have 30 licensed programs going on. So if we can spread to those 30 locations throughout 3 different counties locally, that'll be everything.
I am not a psychologist. My staff are not psychologists. Some of them are becoming lawyers and teachers themselves. So I think this helps provide an extra layer of support for our campers and their families. I know I've already had certain conversations with families already, sharing them some of the resources that the U of R has provided us through the mental health first aid training, and just being able to open that conversation for families and let them know we are here for you, we will help you get through this. We understand that your kids are struggling and the healthcare system can take a long time, but we can help support you through that and connect you to those resources.
When you're in that moment of need and you don't know where to go, that's what the Y's for. Whether that's at camp or in a branch or in a wellness center or in a pool, we need to help connect those dots, and we build community. That's what we do. You know, so having those resources, even if it's just a phone number or a website or a piece of paper, having that is everything.
We need to have programs that help our kids learn and relearn how to play, how to socialize, how to run, how to kick and jump and swim, play music, do the things that kids do. And the YMCA is a hub for all of that in building strong kids and building resilience.